Hey, everybody, it is your captain, Smiles at Sea Captain, Elijah Desmond. It's so good to have with me our keynote speaker, Dr. Bill. How you doing, my friend?
I am great, Elijah. How are you?
I'm doing so good. I'm super excited for you to be coming on board with us. We're coming out of your state of California. For the first time we've done this out of California since 2015. Everybody has been wanting us to come out of California. However, there's a lot of people that have been asking to have you on board the ship. So we're super excited to have you. And everybody wants to hear, what are you going to be speaking on? What are they going to learn when they come to your course?
So last year, I put together a whole new course, which I presented at the AACD. And it was literally one of the highest rated courses I ever had. And this is an updated version of that. And, you know, Elijah, this year is my anniversary, 40th year as a dentist.
Wow.
And what I will do in this program on your ship is basically teach all the skills that I've learned over my entire career for aesthetic dentistry. And I teach it like a hands-on course. There's a lot of video because it's easy to say, okay, well, we're going to do a mock-up, but like you don't get it. Like I videoed it all and I narrated it and I can show you exactly what I did. So, you know, the basic premise of this course is how to master anterior aesthetics in dentistry. And some of the biggest things that are challenges today are things like implants. You know, how do you make implants look natural? You know, and all of that really has to do with tissue management. And I have developed some really cool new techniques on how to do that, how to take impressions for that, so that the lab can emulate exactly what the patient has in their mouth. We'll talk a lot about smile design and how to really come up with a foolproof system so that when your patient comes in, they know what they're going to walk out with. You know, like, I mean, I can honestly say, I don't think I've ever had a patient not happy with their smile when I finish, because of the way we do this and all the steps that we take along the way. They're involved and they approve it. And once I get that approved, it's just simply a matter of getting the laboratory to copy that and make it look the way it does in their temporaries. So we'll spend a lot of time talking about that. And I will literally go at like a cookbook from, you know, sit down in the chair, take before pictures, take before models, to how we do a mock-up, how we take impressions, how we prep the teeth, how we seat the veneers, how we custom shade. One of the things that makes my practice really stand out is I have my own laboratory right in the practice. So when I'm seating a case, if the shading and the color isn't exactly the way we want, Juliet's been with me over 20 years. She will sit there and custom shade it. And if you don't have access to a laboratory technician, I'll show you how you can do it yourself. It's not that hard. I just prefer having her do it because she's better. And it frees up my time to go do other things and be more productive. So I think it will be a really fascinating course because your attendees are going to see things that they've never seen before. And I really am a strong advocate of just breaking things down and making them absolutely as simple as possible and predictable.
Wow, that's awesome. So as you know, you're going to be the opening keynote speaker. You're going to have the entire audience watching you. We have dentists, and some of these dentists, they fly in from all over the world. They're bringing their entire team. They'll have their hygienists with them. They'll have their assistants and their front office. Can you tell me in your course what will be applicable to them? You know, why would they want to come and hear your course? How can they essentially, what can they grab from your course as well? Because everybody's going to be excited to see you, but what's going to be the take home for them?
First of all, one of the things I love about the fact that we're doing it on a ship, like they can't really leave.
Yep.
You know what I mean? Like, but I promise I'll be good. Yeah. But here's the thing: dentistry is not a solo act. It's a team effort. You know, I cannot do the kind of dentistry I do without my chairside assistant. So I'm going to show how Pat and I work together in the videos. And then, the hygienist. I mean, once you get this case done and seated in a patient's mouth, how do you take care of it? I think that it will be really fascinating for the whole team. And another thing that we can talk about, especially with hygienists, is if you have a hygienist who's really into this, they can sell more dentistry than anybody. Because if a hygienist is sitting there working on you and they're saying, gosh, that old bonding that you've had for like 70 years looks kind of bad. Why don't you let the doctor do veneers? You'll look 20 years younger. Bam. Or a hygienist is sitting there cleaning and looks in and says, are you happy with those black fillings? I don't even allow them to call them silver fillings. Are you happy with those black fillings? Who wants black fillings in their mouth? So there's a lot of things that hygienists can do to add to production. And then of course, what they do best is, maintenance and teaching patients how to, clean and keep everything healthy that we do.
That's awesome. In the last video that we recorded in regards to your LEAP Foundation, where you have such a passion for giving back to our youth and the 15-year-old to 25-year-old age group of kids, I was really blown away with the whole cause. And for the people who are coming on the ship, it's super important to know we always give back to a cause. We always give back to a charity. And Dr. Bill's charity is called LEAP, and we will be letting the whole world of dentistry know about LEAP, and everybody on the ship will know about it before they get off. But you had mentioned in that conversation that you actually work on quite a few celebrities' teeth in dentistry. And I think that that's going to get the attention also of some of the audience. Can you talk about maybe some of the celebrities' teeth that you've worked on, and how are they coming to you over some other dentists? And some of the dentists are thinking, man, I want to be like Dr. Bill when I grow up. What do I do to get there?
Wow. So the celebrity thing, I'm in Century City, so when I started, I was in my early 20s, and I was actually dating a young woman who worked at one of the biggest talent agencies there. And all of those kids that were in the mailroom with her are now the biggest, most powerful agents in Hollywood. So that's one way. And then friends tell friends, Jessica Simpson came in, I did her teeth. She was getting married. She's like, look, Nick, I am not marrying you with those teeth. You got to go get new teeth. So they filmed the whole thing on their show, The Newlyweds, and then Jessica refers, Fergie, and Fergie refers Katy Perry. And, here's the thing. If a patient comes in and I meet every expectation they have, they don't care. If I exceed those expectations, they go out and they tell all their friends, and I have a very personal relationship with my patients. 2 minutes before you called me, Matthew Perry just called me and asked me a dental question. They all have my cell phone. I'm there for them. I tell them, you never have to worry about your mouth again. I will. That's my job. And when you exceed people's expectations, they go out and they tell other people. And I really think that's how, we grew our practice.
Wow. That's awesome. That's awesome. So everybody gets to hang out with you for 4 days on the cruise, and we're a fun bunch of people. We have a lot of themed events. We'll have a whitening ball where you wear all white. We'll have a 90s hip hop party. Believe it or not. We'll have a pool party. No costume party this year. Now I need you to think on your feet right now. This is an impromptu question. We have one theme that we still have to pick, and I will ask all my speakers the same question. There's one theme, and it can't be a costume party because that's our fall cruise.
Right. I have it. I'm going to tell you, we do this at LEAP every year, and kids love it. If it glows, it goes.
Oh,
all kinds of glowy stuff. So you don't have to wear a costume. You just get all these glowy things. People love it. It's fun, super easy. You just buy boxes and boxes of those things. You break them, they light up.
Yeah.
Things light up. So I would vote for if it glows, it goes.
Awesome. Love it. Hey, listen, Dr. Bill, you're amazing. Your personality is amazing. You're down to earth. You're easy to work with. It's been a great short journey so far. I look forward to continuing to grow the relationship. And I'm going to tell you all who are watching, this isn't just a 10 minutes of greatness. It is literally greatness every single time that you meet this man. I'm sure he'll be the exact same way on the cruise and on the stage and the podium as our keynote. So you get lots of great education. You'll get to hear about his amazing cause, and you may even get to hear about this amazing business opportunity in which he got retirement plan because of an amazing opportunity with a DSL. I don't know if you want to mention that or not. That's
I know listen, one thing about me, when I get on stage, I am completely and totally honest and transparent. I have nothing to hide. And if there's any part of my life that helps propel any of your attendees to a higher place, it warms my heart.
Absolutely. So I'm excited for you to give some secret sauce to our attendees when they get on the ship. Now, you can't give it all out right now, but when they get on the ship, I'm very excited for them to get a chance to sit down with them and talk to you about this opportunity that you have, that you actually got yourself. And now you're able to essentially share it with other people. And part of that includes LEAP in some capacity. So I'll leave the teaser out there. Just put it out there and say, if you want your life change, you need to talk to Dr. Bill. That is for sure. And we're looking forward to seeing you all on the cruise May 8th and 12th. Any last words?
Thank you so much for the opportunity. I'm super excited.
Yes, thank you. We'll talk to you soon. Bye-bye.